Hey everybody, I actually had a request for a video this morning because well, actually technically it's afternoon now because you guys hadn't heard from me since Catterday. So updates, I'm yawning a lot today. Oh, excuse me. I don't know why I'm yawning so much, but my sleep's been a little interrupted and not sleeping through the night. I'd been taking the Percocet at night, but it's not really doing much of anything for pain or sleep at this point, so I'm probably just going to go back to just doing regular over-the-counter Tylenol and take my Atarax because that just seems to help me sleep a little better. What can we talk about today? Mobility has been, it's okay. I use my little walker here to get around the downstairs. Oh, pardon me. And I use my cane to get up and down the stairs. Still dealing with leakage issues, mucus, the wound, dripping, and all that. It is getting a little easier to do things. Simple tasks like sitting, standing, showering. As far as like household things, I've kind of learned how to manage to get out to the kitchen, fill up my water glass, and get back out here using the walker. So, yay me. Oh, excuse me. Lots of people have been coming by and helping me out, which is phenomenal. I am, again, just eternally grateful to everybody who's been able to come over and help. It seems to work best when I have somebody here in the morning, like around like 8:30. That's about when I get up. Fiona wants to go out and I want to get in the shower and then work my way downstairs and, spend my day down here. Feed the cats, things like that. And then the evening, same deal. Oh, there I go again. I don't even know if I can take a nap because it's hard to find a comfortable position and lay down like on the couch or anything. Even laying in bed isn't comfortable, but it's still better than being in the hospital. So speaking of being in the hospital, I know I had mentioned that I was going to talk a little bit about my experiences. I'm going to actually turn my TV off. It's reflecting on my glasses. There we go. So I was going to talk a little bit about my experience while I was in the ICU and intubated and all that good stuff. So I don't remember leaving the, I don't know what they call the room I was in before going to surgery, but I don't remember. Oh, sorry. I don't remember leaving that area and going down the hall to surgery, but Brian said that I was already like pretty much out by the time they even started to wheel me out. I think, I don't know if I've mentioned it. I know Brian had posted or sent out some updates with stuff coming directly from the OR that they were not able to do the robotic surgery because I couldn't breathe in the Trendelenburg position, which is how they needed me to be to do the robotic surgery. So, and again, this is directly related to my weight. And it's been something that I've been very aware of for a long time that I need to do something about it. And I started to do something about it a couple years ago and was making a lot of great progress and then just kind of gave up. So I need to get serious about it now, because that was really what caused a lot of the complications and the lengthiness of the surgery itself and the recovery time. So again, it's going to be a lot of really being more aware of what I'm putting into my body. I always ask people when I'm trying to take better care of myself to kind of back me up and call me out. If you see me walking around eating a Snickers bar, just remind me that this period really sucked because I'm fat, and the Snickers bar is not going to help me if anything like this happens down the road, which hopefully it doesn't. But I don't want to go through something like this again, but you just never know. I wasn't expecting it this time, and here it was. So at some point they got me to the recovery room. I vaguely remember my aunt being there, and Brian being there. Brian had said that I had was reaching out for his hand, and that I kind of remember. I remember looking for him a lot. I remember kind of coming to a little bit and trying to look around the room for him, because I didn't know when he was there and when he wasn't. I had no idea what day it was, what time it was, but I was in and out a lot, which was weird because I was kind of under the impression that I would have been pretty unconscious the whole time while I was intubated, but I guess they bring you in and out. I'm not really sure how that works. But there were a couple of situations with the nursing staff that were really, really frustrating for me. As I had mentioned in an earlier video, they did have me restrained to the bed so that I wouldn't pull my tube out. And that made it really difficult to get the attention of the nurses. There were several times where I would hear the nurses right outside my room and be trying to get their attention, and the only way for me to get their attention was for me to bang on the bed rails. I couldn't find or didn't have a call button within access, which was, the whole thing was just really freaky, uncomfortable, scary. At one point, one of the nurses, they were washing me, and I was, it was one of these points where I was sort of conscious, and they were rolling me, which of course was incredibly painful. You can't be laying on one side for multiple days straight like that. You worry about skin breakdown, all that good stuff. So, and of course my lungs too. They were trying to get my lungs to clear out by moving me around. But while they were bathing me, I don't know if I was having difficulty turning or what was actually happening, but the nurse actually said to me, "Come on, Danielle, we've got to get you bathed. You stink." And I don't know if she thought I wouldn't remember that or thought I couldn't hear it, but it was clear as day, and it was not the kind of thing to say to a patient who is in the ICU in the kind of position I was in. So I don't know which nurse it was because I couldn't really see what was going on. It was more that I could hear things that were going on. The night before they extubated me, I was having some really weird dreams. Now, mind you, they took me off all of my medications during the time of the surgery. The only thing that I was taking post-surgery was potassium, because they had to give me Lasix to try to bring the fluids down, which then brings your potassium down. So they had to keep giving me potassium, which I take daily anyway because of my heart issues. So if anybody's ever seen a potassium tablet, they're enormous. And they were cutting them in half for me. I was having no issues with swallowing. But because they were concerned about my swallowing, even though I was having no problems with it, they weren't giving me any of my other medications, such as my Cymbalta, my Lamictal, any of the other, I think some of the heart meds they were giving me intravenously. But being taken quickly off of any kind of like psych meds like that, antidepressants and things, being taken off like quickly, and it can cause a lot of withdrawal, and it can cause a lot of discomfort. It can cause a lot of anxiety, all of which I was experiencing. And one of the pills I take too is I take a mini press at night, well actually in the morning because of my working night shift, but I take mini press to help with nightmares, which are mostly related to my mom's death. I was having a lot of nightmares with her kind of coming back, not really being dead, but like she like ran off and like abandoned me, and then came back and was really like out of it, but then sort of came to and then would abandon me again. So it was sort of like experiencing the trauma of her death over and over and over again through these dreams. So in the last like year or so, they started giving me mini press, and it has just done wonders. Well, they weren't giving me that in the hospital either, because my blood pressure tends to run low because of all the other meds I'm on. So they didn't want to give me an additional blood pressure medication. So anyway, Thursday night, before I came out of, before they extubated me Friday morning, I was having some really whacked out dreams, and I could hear the nurses outside my door, but I also swore that I heard Miss Heather Starosky on the phone. But it was really weird because it was almost like I was in the middle of this 4-way phone call between her, my older brother, his wife, and another friend. So in this dream, this other friend kind of had a thing for Heather, but Heather didn't want to get involved with him. And then somebody somewhere was like talking smack on my brother's wife. So then my brother was getting defensive, and there was this whole like crazy phone call with them all yelling at each other. And I was getting really stressed out because to me, this dream I was having was like very real. Like it sounded like the people were like right next to me. So again, I'm banging on the railing of the bed, trying to get the attention of the nurses, because I want to tell the nurses to tell my friends to leave, because I really think they're there at this point. So again, I hear the nurses out in the hallway. I'm banging on the railing. Nobody's coming in. I hear another nurse come down the hall and say, whose patient is that? Don't you hear the banging? And the one nurse says, oh, it's my patient. And she says, well, do you know her? Like, have you worked with her? She's like, yeah, I've been with her the last 4 nights. I know her very well. Like, got really snippy, as if I was this like troublemaking, horrible, awful patient who was unconscious the whole time, you know, she was working with me, who had difficulty responding to any of her commands. So I don't know who she was. She was probably the one too that told me I stank. But it was just bad. So the nurses then came in the room, and I'm trying, of course, I'm still intubated, and I'm trying to tell them to tell my friends to leave. And I don't know how I finally managed to get that out, but they eventually understood, and they were like, nobody's here. You know, and I was like, oh, okay. And then I stopped hearing whatever I was hearing, and I guess went back to sleep. And the next morning, thank goodness, they extubated me and then left me tied up with one restraint. So the ICU was a really horrible place to be. Even though I was unconscious the majority of the time I was there, it just sucked. I was very much less than impressed with the nursing staff. I am a type 2 diabetic, so they were also checking my blood sugar. And one of the day shift nurses, who was consistently almost impossible to find, the way she would check my blood sugar is she would take the alcohol wipe my finger, not give it time to dry, stick me, wipe the first drop away with the alcohol wipe, check the blood, and then give me the alcohol wipe to hold over the stick. And I mean, I'm a tech and I know not to do that. I know that the alcohol burns when you have an open wound there. I know to use the 2x2 gauze to wipe away that first drop and to, hold it over the patient's finger. So, I mean, this was a nurse who had, I think she told me she graduated from nursing school the year that I was born. So this woman has got like 40 plus years experience as a nurse and doing things like that. So, so that was a thing too. And then they wanted to do the swallow study, and they kept letting me be on the clear diet and then taking me off the clear diet, and NPO and no fluids. And it was just crazy. Again, the only nurse that I had in the ICU who I really felt was professional and responsive and, treated me the way a patient should be treated was that Merce Logan, who was just wonderful. And the whole team, like I said, I think I mentioned this before too, the whole team he worked with was great. That whole shift, they were coming in together to help me with the things that I needed help with, and they were all working together, which was just really the way it should be. Meanwhile, that day shift nurse was constantly searching and hunting for somebody to help her to slide me up on the bed, or to help me get out of bed, or get me to a bedpan or whatever. Once I got into the 7K unit, it was just much better from there. I had much better care, much better nurses, and they have a bigger workload up there too, which is strange, or bigger patient load, I should say. The ICU has one nurse to 2 patients. Because they are more critical, but then they only have 2 techs on the floor the whole time. And there's like 30 some beds, I think 32 or 34 beds. So it was interesting to see how all of that operated in comparison to what I'm used to on the BH units, and what I know to be professional behaviors and the way I was treated. So, there definitely is going to be a Press Ganey filled out, and, there will be kudos where kudos are deserved, and where the poor treatment and the disrespect happened, that will definitely be mentioned as well. So anywho, that's pretty much the gist of it for today. It's a really long video. It's like 20 minutes. It's going to take like an hour to upload this thing, but while it's uploading, I think I'm going to try and see if I can kind of get comfortable and maybe take a nap. Happy Monday, everybody, and thanks again to everybody who's been helping. I don't know what I would do without y'all. You're wonderful folks, and I am blessed to have you in my life. Thank you, thank you, thank you. I'll talk to you soon.